Hello, everyone. Good evening. My name is Honi Guterres, and I'm the Director of Alpha-1 Global. And it's my pleasure to welcome each of you to this EU Advocacy training webinar. The Road Public Policy Group in Brussels has worked hard on preparing the materials and the content for this. So without further ado, I would like to introduce Jelena, Malinina, and Kit Greenop, who together will be conducting this evening's webinar. Thanks to you both, and you guys take it from here.
Excellent. So with no further ado, we're going to take a quick introduction and a bit of background to where sort of Alpha-1 advocacy is in general across Europe at the moment, some of the work that has been done at European level, and then really dive into some of the key opportunities that we see for improving the advocacy around Alpha-1 across Europe. We're going to be really going through that checklist in detail and talking through hopefully a lot of the opportunities that can be provided to improve and enhance all of the opportunities at national level to advocate for Alpha-1. So a really quick background, and I don't want to bore you with details about us, but we are a consultancy based in Brussels primarily, but we have offices across Europe. And we work on policy creation and development. And we've been partnered with Alpha-1 Global in our most recent project since the beginning of 2017, although we've had previously worked with them back in 2011 as well. Our work is really about trying to inform policymakers of areas of high unmet need, especially where there are significant issues in patient access to medicines and other related conditions. One of the important points of our work is trying to impact legislation, any laws which are going to impact the access for patients. And so I wanted to just quickly give a few examples of what that can mean. So in terms of actual legislation at European level, there are several overarching laws which impact how we can try and get access to medicines, or we can get better diagnosis for rare diseases, for example. So our organization was involved in trying to frame the definition of what is a rare disease when the Cross-Border Healthcare Directive was created. We also worked to put in a definition of an ultra-rare condition in the clinical trials regulation. And these things really help to shape how national efforts on policy are subsequently taken up. We've done a lot of work after the Cross-Border Healthcare Directive, which started calling on member states to implement rare disease plans. And we worked with a number of patient groups, Alpha-1 is one of them, in trying to impact policy on a national level. So taking those national rare disease plans and seeing how can we make sure that there's funding to support these plans, and then how can we also best achieve the desired results of those plans. So whether that be the uptake of newborn screening, improved diagnosis, better access to hospitals, better access to treatments. So we've been working on a lot of those plans as well. So I now want to give sort of a bit more context to the current European work that we've been doing with Alpha-1 Global over the last year and a bit. So in 2011, there was actually the first ever sort of documented policy recommendation on Alpha-1 antitrypsin deficiency in the European Parliament. This was a set of recommendations which were really trying to put the issue of Alpha-1 onto the map for policymakers. These were a really important first step and got a lot of policymakers engaged with the topic. However, in 2017, we started our discussions with Alpha-1 Global about the fact that there have been so many changes in rare disease care. There are now European reference networks. We have a new, much more connected research area in Europe. There are obviously more and new exciting treatment opportunities for Alpha-1 antitrypsin deficiency. And also, of course, there are changes to the legislation around how medicines are manufactured and produced across the EU. So we took up this challenge to try and update the recommendations on Alpha-1 antitrypsin deficiency with this publication, which is called Time to Get Better. And in this recommendations document, we targeted recommendations for policymakers at European and national level, and also for patients and for doctors. So we see that there's a real clear need to inform policymakers about what they can do to improve the care for rare disease patients, to make sure that they actually have the tools to enact those changes. So we put together in collaboration with Alpha-1 Global, a group of experts at European level committed to building these policy recommendations from countries across Europe. And we put together this document, which was launched in the European Parliament last year. In order to put this event together, we had a series of meetings with stakeholders representing patients and doctors, but also with members of the European Parliament, who eventually hosted our event in the European Parliament. As you can see the pictures on screen at the moment, this event was well represented by members of the European Parliament, who gave a strong commitment to supporting Alpha-1 antitrypsin deficiency needs and trying to impact European legislation where they could to really bring better care to European citizens. So in that bottom picture, we have a lot of policymakers and key stakeholders aligned, holding up the new booklets, making a commitment to try and implement the recommendations in that document. We're going to come back a bit later to the kind of power of these type of events, but I think this is already just a good idea of what happened, because we'll be referring back to what these type of activities can actually bring to the awareness and impact of advocacy efforts. So I think it's important, before we get started and start talking about what are the different tools we can use to try and improve rare disease care and Alpha-1 antitrypsin deficiency care in particular, we have to think about what do we really want to achieve. So the first point is obviously to try and empower the Alpha-1 community. We want to try and look and in that continuous search for a cure to improve funding opportunities for Alpha-1 research. Certainly where there is treatment that's becoming available, to ensure that there's increased awareness on Alpha-1 to mean that diagnosis is better, we can find more patients. And finally, we want to try and reduce the inequalities across Europe and within different countries in Europe about access to care and treatment. It's really important, I think, that these are really enormous goals, but we should remember that every change really starts from a very small first step. And what we'd like to discuss with you today is, after many of the steps which you've made, of course, some of you have been around for many years, some of course are quite newer organizations. How can we try and make some new steps in this direction to try and improve the care for rare diseases and care for Alpha-1 in your countries? So on a European level, I just want to share with you that the next big step in our project after the policy recommendations that were launched will be the creation of a European Alpha-1 Awareness Day. And the, trying to change slides. This will be celebrated for the first time in Brussels at European level on April the 23rd or 24th. We're still just trying to confirm the final details on that day. And we have some very strong hopes of what this can deliver. And my colleague Jelena is going to talk a bit more about what events can actually do for improving advocacy for patients. But we'd already like to just inform you about this date. Please pencil it down. We're going to come back to the importance of this day and what we can also try and leverage from this day as well. So I will now jump in straight away to the first sort of area of our introduction, which is about what the EU does and how can it actually help you to drive change on a national level. So to let you know that throughout the presentation, there are going to be some polls which come up on the slides. Please fill those in, give us your feedback, and we will then sort of reflect on some of the results which come through. So the first poll question, which will be appearing on your screens soon, is going to be about how the EU can help to enhance your national advocacy efforts. There you go, that should have all popped up for everyone. Please, if you can, fill in that. We'll get some interesting results back. I think there's a lot of very understandable confusion over what the European Union can actually do for patient groups in member states across Europe. So please let us know what you think. I'm going to very boldly say yes and submit from our side and look forward to seeing the feedback from the rest of you. I'll start to kind of dig in. As you may know, there's a perfect. So there's good feedback already straight through from everyone. So 75% have indicated probably no. There's not much clarity on what the EU can do for a national advocacy effort. And I think that's very understandable. And the prime reason for that is that, as many of you know, there's a difference in competence between the European Union and member states. So on a European level, really the biggest goal for them, and that's been enshrined in the latest version of the Treaty of the Functioning of the European Union, is about trying to ensure that all citizens across Europe and all policies that come out of Europe have a high level of health protection. And there is actually now a legal right to the European Union to assist member states in coordinating their health actions and collaborating in the field of health to ensure this high level of protection of human health. So they're also involved in a lot of work on standard setting, regulations concerning the approval of medicines. And of course, the European Medicines Agency is also a part of the European Commission, which regulates the introduction of new products onto the market. So any new medicine which wants to be authorized in Europe has to go through the European Medicines Agency. There are also increasing areas of collaboration at European level. Traditionally, it has been national governments which are responsible for financing all of new medicines which are coming onto the market, organizing their healthcare systems, and making the big reimbursement decisions, which at the end of the day, we're all hoping for better reimbursement for alpha-1 antitrypsin deficiency medicines. Now, after 2020, there's been a regulation which has been actually launched today, a proposal for a new regulation which would give the European Union a competence to provide one clinical health technology assessment which will cover the European Union. If this were to take place, this would obviously mean that the European Union has an even greater role than we're trying to suggest that it does today. So this is the very technical approach to what can the EU do in terms of its competence on public health. But I think that probably still doesn't really answer who are these people and what can they do for you. So this slide just shows you who are the three institutions and what are they doing on public health. So there are three main bodies which comprise the European Union: the European Commission, the European Parliament, and the Council of the European Union. The European Parliament is elected by all of us who are European Union residents. This is our direct elected democracy in Brussels. There will be new elections in 2019, so we will have a right to try and select the new policymakers coming in 2019 to represent us. We then have the Council of the European Union, which is a representative of all of the member states' governments. So all of your governments are represented in Brussels through a permanent representation, which is always here representing your interests in Europe. And finally, there is the Commission, which is the executive wing of the European Union, which is responsible for initiating legislation. And they have three principal areas of interest for us: one which focuses on research, one which focuses on healthcare policy, and one which is on the approval of medicines. So there you have DG Santé, DG Research, and the EMA. In the European Parliament, as in many of your national parliaments, there is a committee responsible for healthcare policy. This is the ENVI committee. And again, we'll come back to that in a second, why that's relevant. And in the Council of the European Union, there's a healthcare council. So what we're trying to show here is that across the European Union, in each of the three bodies, there's very clear focus on health. And there are really dedicated people in each of these areas working on health. So there's always going to be someone to contact and someone that can be interested in the type of area we are working in. The European Parliament, however, is probably the most relevant to all of us because each of us has representatives which we've elected who sit in Brussels and are supposed to be acting on our behalf. This obviously means that we have a very good opportunity to go to them with our concerns and try and state to them, how we think that they can help and how they can support us. So we have 751 members of the European Parliament spread across all of the different member states. And this is a really key institution to try and drive change in the areas which we identified in those policy recommendations, Time to Get Better. So you may know a bit about the makeup of the European Parliament. As in any parliament, obviously it's comprised of different political groups. The biggest group in the European Parliament is the European People's Party. This is the centre-right group. We have then the Socialists and Democrats, which are the centre-left group, and followed then by the two second sort of tier of parties, which are the European Group for Conservatives and Reformists and the group of the Liberals. So these are the four main groups which make up the European Union and are kind of considered the mainstream groups which we tend to engage with here at the European level. Now, it's important to note here that, of course, while there may be a lot of representatives from some of the smaller fraction groups, it's often politically wise to try and identify with the larger groups, not only to try and help with more votes if there's a resolution on the table, but also to make sure that Alpha-1 antitrypsin deficiency is not associated with an extreme cause or anything like that. So this is useful to keep in mind if you're contacting a member of parliament or a member of European Parliament. Find out what the breakdown of the different political parties is and how they may be of use. So my last point about the European Parliament is just to say that we should all know how many representatives we have. So, if you're on the line from Germany, you have a wonderful advantage that you have a choice of 96 members of the European Parliament to choose from that could be relevant to you, could contact. Of course, our colleagues in Estonia and Luxembourg only have 6 MEPs. This is obviously a factor of the size of the different countries. And within each of these countries and each of these delegations, there are a number of people which will have a focus on health. Of course, if you have a big country, you'll probably have a few people which are specialized on health. And so you'll have a few distinct people you can really go and contact to talk about the concerns which you may have as a European citizen. In the smaller countries, people will be more likely to be generalists. So this is kind of a very brief overview of what the EU does. Hopefully in these first few slides, I've been able to explain what are some of the key functions of the EU, what are they doing in the areas of health, and why may this be relevant to some of the work we're doing. If they're not, we can try and come back to this in some of the question and answers afterwards, and hopefully we can talk through those more. It now gives me great pleasure to pass over to my colleague, Jelena Malinina, who will be talking a bit through the checklist and how we can really try and implement these type of advocacy ideas at a national level and what that can do for patient groups. So Jelena, I pass it to you.
Hello, good evening. So I'm going to speak about the checklist, which you have probably seen before. And I would like to go together with you through each steps. We have 5 steps in total, and we will be doing some practical exercises together with theoretical side of the checklist. And before we go, I would like to ask another question through the poll, whether you have an advocacy strategy in your organization. So please click yes or no. Interesting results. So 56% said yes and 44% said no. So half-half. This is very good. I hope, despite you might have a strategy in your organization, this part will still be useful for you, because we will try to implement some of the European elements into this strategy. And as we know from our poll question number 1, not everybody is familiar with the EU structure and how you can use it for your advocacy strategy. So I go to our first step, which just for some reason is not going. Yeah, here you go. So this is the first step, and probably one of the most important, because here I would like you to think about what are your top political asks for the moment, for this year, for the next month, and what would be your long-term strategy possibly related with this goal. This is a very important question to ask ourselves, because the entire success of your organization and of your campaigns will depend on how well you define this ask. And the more specific you will be, the more successful impact you can make with this ask. So first of all, it's very important to understand what is the environment. I'm sure you know it very, very well, because you deal with it on a daily basis. So one of the most vital questions any patient organization can ask, and especially in regards to Alpha-1 condition, whether you have treatment in your country. So depending on the answer, yes or no, then we move to a different types of messages. So if you do not have a treatment in your country, this is of course very unfortunate for the daily life of any patient, but it's very fortunate for political asks, because here there is a big variety of how you can present your problem to the policymakers. We all know that Alpha-1 community is relatively small. I know that today participants come from very different organizations of different scopes. Some of you have many members and more capacity, some of them have less capacity, but in general, if we look in comparison with other diseases, such as chronic diseases, rare diseases will have less community. And one of the tricks is to connect your rare disease with other diseases, which we also did for European expert recommendations. We connected Alpha-1 lung site with COPD. So it gave us much broader support, and this is also the message we have been using on the European policymakers, because COPD is very much discussed at the European Parliament. There is a dedicated group. There are quite many activities taken in regards to that. And one of the examples, if you do not have a treatment, try to find something bigger than Alpha-1 and connect it to this political issue. Maybe it will be much more supported and much more visible, because this is the other side of a bigger disease area. So in that case, one of the examples of what political message could be is that Alpha-1 is the only form of chronic obstructive pulmonary disease which has specific treatment. And we all know that COPD is basically, there is currently no treatment, but you can have therapies which are helping you to have a good functioning lungs. So by linking those two, we have a very urgent problem, let's say, and it's something bigger and it's more understandable for the policymakers once you connect it to something else. The same here might go to air quality topic, because once again, we're speaking about lungs, we're connecting it with something else. If there are any liver complications here, it might also be somehow connected to alcohol policies, because there is a big stigma that any complications of the liver are linked with alcohol intake, and this is also a good field to put your message saying, look, actually it's not true. We have a disease which affects our liver to the extent that we need an action in this field. So if it happens that your country among the lucky one and you have a treatment, then the next question, of course, to ask whether the treatment is reimbursed. So if it's not reimbursed, the possible message is to basically bring figures to the policymakers, which they really like, to say that while policymakers and payers are considering whether to reimburse a certain treatment or not, in case of Alpha-1, they must consider the number of rapid decliners that would receive augmentation therapy rather than the whole patient population when assessing cost-benefit of that specific medicine. This is usually very powerful way to go to say that by investing in this treatment, you would actually save money. And unfortunately, often it's done on the cost-benefit rather than the value of treatment itself. So if the treatment is reimbursed in your country, this is very good. You then still can identify plenty of other issues. It depends on the context of the country, but usually in the context of Alpha-1 and any other rare disease, is the big problem is diagnosis, and many Alpha-1 patients are still not identified, despite there is a treatment, despite there are good care plans. They do not use it because they simply do not know that they have Alpha-1. And in that case, the message can be linked with asking the government to include Alpha-1 into other guidelines for testing, such as for COPD or cirrhosis, to include the mandatory tests for Alpha-1. So here, it would depend on the concrete context of your country. And now I would like to proceed to our practical task. So I would like to ask you to think what would be your specific political ask, link them maybe with a little bit broader goal, which would you like to achieve in a very, very long term, let's say in 2, in 3 years, and how this political ask would lead you to your strategy accomplishment. So now we would stop for 5 minutes. We will give you time to go to your checklist and to fill in these 3 fields to think a little bit about that. So after we finish our webinar, you have something to take away with you. But before that, I would like to ask you whether you have any questions on my previous slides on what have been told before. So if you do, please type them in the chat or raise your hand so I can take them now before we go to the practical task. So there are no questions. So now we are stopping for 5 minutes. Please use this time to fill in these 3 fields which I mentioned, and we will be back in 5 minutes. You will hear the music meanwhile. Okay, so we are back. I hope you put something together for this task. If you will have any questions which you might have while you were doing this task, or you would like to clarify whether your ask is good to be targeted to the policymaker, and whether it's going to be a very successful ask, we can address all these questions in our Q&A session afterwards. So there will be more tasks, and there are 4 more steps, so we can address them all together. So now we're moving to our step number 2, mapping the policymakers. And before we go to our theory, I would like to ask you whether you have been previously engaged with the policymakers. It doesn't matter whether at the national level or European level, policymakers in general. Very good. So we have 67% yes and 33 no. This is very good. So maybe then during Q&A session, you would be able also to share your good and bad practice examples of your experience of communicating your asks to decision makers. In case you have never done this before, the first step to identify who you should really come with your ask is to look at the health settings at the national level. So it might be the Parliament, the Ministry of Health, the Medicines Agency. It really depends on each of the national country context in that case. However, it might be also the case that there is no dedicated department or committee or anyone responsible for rare disease policies, and they deal with health on a general level. Then it's a little bit more difficult to do so, but it's also possible. Then in that case, you might just look into active politicians, maybe try to find some cross-cutting issues, such as, once again, I have mentioned air quality, so maybe your country is not that active on health, but more active on the environmental issues. That's also an option, to find someone and tell them, look, you work on this, and this policy actually affects our health, and go ahead together with this politician and make that politician champion in Alpha-1 area. So yeah, it might not also be the rare disease area, it might be general health, but it's more about how active the person is at the national level. That's the part we know the most. It's how to engage with the European policymakers. So in case you have never done that before, this is an excellent tool to basically find out who represents you at the European Parliament, who are your policymakers there, who is responsible for your well-being at the European level. So at your, I'm not sure if you will be able to click the link here on the webinar, but you have it on your checklist. There is a link, and we will do a little exercise a little bit later. So basically you will go online and you will see the similar window which you see now on your right. There you can basically pick your country. Here's the example of Romania. So I'm typing, I'm choosing Romania from the bar, and then in order to diminish my search and find someone more relevant from Romania who would be more willing to accept my asks on health, and specifically Alpha-1, I go to the political bodies section and choose the committees. So Kit mentioned before that within the European Parliament, there is a committee called Environment, Public Health and Food Safety Committee, ENVI. So there are many MEPs who either the members or substitutes, it doesn't matter that much. If they appear in your results, then they will be part of it, which basically work on issues on environment, public health and food safety. For some countries, for a bigger one, for example, for France, they do have sort of unofficial division between their competences. So let's say there are 5 MEPs from France who work in ENVI, And most likely they will divide their responsibilities to one who is responsible for environment, another one on public health, and so on and so forth. But yeah, for smaller countries, that's a very good tool to find out the one who is concentrated in all three areas. Once again, it's important to look to which party your member of the European Parliament belongs to, whether it's the bigger one, whether it's a smaller group. With the smaller groups, they're still, of course, relevant, but it might be the danger that this politician comes from quite radical party at the national level. You will see, for example, for this example, we have the big European party of Daciana, and then you will have written in the national language her local party, which I'm sure you will know. So yes, this is how to find the member of the European Parliament, why it is important to have them. Despite it might seem that they are too far away and they do not have a say at the national level, we have many examples and of how they can actually drive the change at the national level. And now is a very, very good moment to actually present your asks to the policymakers, because the European Parliament elections are coming up. So everybody will be more than willing to portray themselves as good policymakers and to be re-elected to the Parliament once again. So they're more than happy to engage with you as electorate, as their representatives, voters, right now and in the upcoming year. And if you're coming from Bulgaria, Austria, or Romania, pay attention to the EU Council presidencies, because all of these three countries are having them, and it's also an excellent time to engage with them. So now I'm moving to the practical tasks. So if you can follow the link, which is in your checklist, it's the find out who represents you at the European Parliament. You can just click on it and check out whether you're finding someone from your country and who would it be. Then the same exercise goes for national representatives. You might just have a little draft of whom you might contact at the national level, and whether there are any other stakeholders. Maybe it's another patient group, maybe it's another big organization in your country. So please, for another 5 minutes, we have this task, and then we're back. Okay, we're back. Just a short remark on your task. I hope you managed to find some members of the European Parliament you might contact in the future. Just a short suggestion, if you have doubts about your member of the European Parliament, you can always contact Frank, because he knows the system very well, and he might suggest you on whom to contact the best for one or another case. So we move to our next question, next step, on how to connect with your policymakers. And now we will have a series of poll questions on your social media. So first one, do you have a Twitter account? Personal or your organization account? Again, we have majority has a Twitter account, which is very good. And just a little bit more than 30% do not have one. So based on that, we move to the next question, whether you are connected with other Alpha-1 global members on Twitter. Same results, 67% yes, and 33% no. So I guess it's those who might not have account. If you do have account and you're not connected, this is a strong encouragement to do so. Then our next question, whether you have been in touch with your policymakers through your Twitter account. Here the situation is slightly different. Most of the people haven't done this. This is very good. We have something learned today. And the last question, just to have an idea whether your organization has a Facebook account. So here almost all participants do have a Facebook account. Very good. Most of the tips will be related to Twitter today because it's a more specific tool which targets policymakers, but many of them will be also useful for Facebook. So if you have a Twitter account, this you might already know, or it may not be a Twitter, but Twitter, we found it as the best tool actually to target policymakers, because there it's not an email which you send and which is lost somewhere in the mailbox or worse in the spam folder. This is something which policymaker will see directly. Plus, in addition to that, you can always tag someone else So your message will be seen by multiple people, and it always creates attention, whether this person wants or not. You can always create a great visibility for one or another problem. Same goes, of course, for Facebook or LinkedIn or any other social network you might be using. Try to find out who is in there among your policymakers. It might not be the case for some of the countries, because we know that Twitter is not as popular everywhere. But if you would like to connect with the members of the European Parliament, the good news is that most of them are active Twitter users. So this is the tool where you can type your messages, put your asks, and require an answer, because it creates also great public visibility. So an example of a good tweet, which will create a lot of visibility and also will attract attention of other users in their newsfeed, is the tweet which contains a picture, which contains an image. It might be a video, it might be anything else, but it has something attractive to look at. This is the science. So there were many studies done on this, and yeah, and basically, if you have a message supported by the picture, that would be a stronger message than the message without the picture. So Twitter allows you to tag relevant people, organizations. Also, when you post a picture, you can tag up to 10 organizations, and it will not eat the space of your characters, which is very handy and very useful. All these people will see that you wrote to them specifically. So here, once you targeted policymakers on social media, this is, of course, a very good situation to ask for the physical meeting and to talk with them face to face. To save time a little bit, you will have all of this together with your checklist. You will have this checklist within the checklist with you. So I will not go through step by step through this, but just general comment that the meeting with anyone, and especially with policymaker, requires a little bit of preparation, and this makes this meeting very efficient. So firstly, it should be very short. You should be able to put 2 or 3 messages and present them in a very short time, and to grab attention of your policymaker during this meeting. You should share your story. There is nothing more touching rather than hearing about personal impact of any disease or any kind of political situation. Then you can really see that there are people behind it, that it's not only ask for the sake of asking. And then, of course, to build a relationship, it's very important to follow up after the meeting, to say thank you to your policymaker. It might not be the case that the policymaker was very friendly or very supportive, but you never know how the weather changes, so it's very good always to try to keep the good relationship. And if you see that the policymaker is very friendly to you, it's also a very good opportunity to ask him or her whether he can recommend other supporters, whether members of his political party would be interested to move your ask forward. So here we move to the step 4, no poll here, so we're going live. So it's very important to be active online. As a first step, many of you have been doing amazing work with translating the English version of the recommendations. So please show your work to everyone, post it on your website, post it on Facebook, on Twitter, tag MEPs, tag your national members, tag everyone, send it everywhere. So based on the messages you have developed today, maybe you will develop in the future, be active always. If you do not have that much capacity or you don't know how it works, it's also very good just to go to the Alpha-1 Global Twitter account, maybe Facebook, maybe website, and retweet what has been posted from them. It's always very good. We also will have an account which will be dedicated to European Alpha-1 Awareness Day. So we will become quite active, probably starting from March and April on that platform. So we will invite all of you to join us and to share our messages as well. And of course, you are very welcome to share your story anytime on Alpha-1 Global post blog. So you can write a post there, and you will see the link, which is both in this presentation and in your checklist. So here there is a little practical task. I would like to ask you to think about several activities which you can do in the upcoming 3 months, so in February, March, and April. Here we will not spend 5 minutes, it's going to be a little bit shorter. We'll have 3 minutes for that. So just a little plan, what can you do? Maybe it's just going to be first to set up Twitter account and connect with those members with whom you haven't connected before, or find out some policymakers and connect with them. Can be anything. So please go ahead. I will see you in 3 minutes. Yes, we're back for our last but not least fifth step on how can we all prepare for the celebrations of Alpha-1 Awareness Day. We have mentioned earlier that this day is planned to be on 23rd, 24th of April. This would be the first year when it will be celebrated at the European level, and we will be working on the event at the European Parliament to celebrate it. There will be several tools which we will be developing, which we already started actually to develop, but they will be coming up in the next several months, and which we, of course, would ask you to use. So this would be the banners for social media. So if you have any kind of social media account, we would strongly encourage you to use them, because these banners will be not developed only in English, but there will be also other languages. So this is very handy. So you can have your own language probably too. There will be up to 8 languages this year. Then we will be outreaching a lot of members of the European Parliament, and we will be asking also from 5 to 8 members of the European Parliament to record the message on Alpha-1 in Europe and in the country they're coming from. So this message is foreseen to be developed at the national language. So if your language, if you will have an MEP with your language, please share it, please support, because this will be very important also for them. They will see that this is something well taken by the future voters and their national public. So yes, we will have also an article related to this day. So this article can be, of course, translated. So if you will not have any idea what you can write about, you can just take the article, which we will draft in English, translate it in your language, and bring to your news portal, newspaper, or anything you can think of. So it would not, some of the activities would require more work, and some of them will be ready for you to use. So as soon as they are ready, we'll be happy to share them with you. So those activities are mostly online activities. There is another option what you can do to celebrate European Alpha-1 Awareness Day. Maybe not this year, maybe it will be next year, maybe in 2 years, but this is something to keep in mind. This is very good for building the community and also to building the political support, is creating an event which will be specifically targeted to your political asks, to your political issues, maybe general awareness issues on Alpha-1 in your country. So there are several options. One of them, it can be host a lecture or workshop together with other patient advocates or maybe healthcare professionals. So you can just come to your doctor and say, look, I would like, I don't know, these people to know more about Alpha-1. It can be other patients, it can be general practitioners who may not know how to refer correctly to the specific center, how to recognize Alpha-1, and so on and so forth. Then it might be a community lunch with policymakers. So based on our previous step, you might find out that there are certain policymakers, might also be an MEP. They are very often 1 week actually per month. They are at the national countries, and all of them are having national offices. So you don't need to come to Brussels to meet with an MEP. They might not necessarily be all in capitals, so it depends where they come from. It might be a smaller town in your country. So yeah, this is also all would be visible from the link you have already tested. If you go to the European Parliament, you will see the profile of your MEP, and you can see where the national office is located. And they're very happy to meet when they're away, because they're less busy and they have more possibilities to communicate with civil society. So yes, it can also be simply coming to your hospital and bringing the recommendations, which you might have translated if you didn't, might be even in English, and telling to your doctor, please have a look and please give it to your colleagues. Another example which requires a little bit more preparation but has very good and powerful impact is an event organized at the Parliament. And here I would like to give a word to Kit. Recently, he has been working on the event for the National Patient Organization in Madrid, and he will tell you more about his experience with that.
Thanks, Jelena. Hi, everyone, again. Yeah, I don't want to take up too much time, but I think it's important, you know, as we're getting to the end, that we kind of remember sort of why we've been suggesting all of these things. What is it that we think, you know, European Alpha-1 Awareness Day can actually do? So I think this example is a really nice way of targeting into those questions. So an awareness day is something which means that if we can make it spread properly with your support, with support at the European level, with support at the national level, we can have a day where European people, doctors, patients, politicians are thinking about Alpha-1. And that would be a really wonderful experience to have one day where we can all say, this is where we get together to really make some concrete asks on what we need to do for patients with Alpha-1 antitrypsin deficiency. So why celebrate it this year? Well, celebrate it this year because, again, there's going to be the first time it's ever going to happen. We're going to be providing some tools. And then, of course, there are plenty of things that you can do on your own. Jelena suggested exactly this last one, which is the idea of a national policy event. This is kind of the most extreme. And I would think probably when planning in what can we do as an advocacy effort for 2019, for 2020, these are some of the ideas maybe that you can take inspiration from or think about doing in the future. So what do? We had a European level recommendations, which were recommendations on primary immunodeficiency care. So this is another plasma-related disorder on where people have a lack of an immune system. It's also a rare disease, so it shares a very similar profile with Alpha-1 in that sense. We had these recommendations at European level, and one of the main asks that we had realized was, while there's treatment, actually too many babies aren't being found with a very rare condition. So we decided that on a national level, our call would be to try and ask for more newborn screening for this disease. So we did a lot of work in a lot of the areas that Jelena has been speaking about, putting together our key messages, putting together a strategic approach for engaging with policymakers. We went to our friends in the European Parliament who we'd been working with and asked them, can you suggest some colleagues at the national level? Who do you know working in Spain on healthcare? They gave us some tips. Our Spanish colleagues also looked into who were the national people working in the area of rare diseases, and we got in touch with them. We sent them our materials. We contacted them not only through email, and we organized meetings. We also started engaging with them on social media and started talking with them through those means. With their help, we were actually able to organize an event in the Spanish Congress. So we were able to get a representative from every single political group who their spokespersons for health were. So all of these members of parliament who are speaking on health for their political parties came to this event and made a commitment that they were going to make sure that newborn screening was a key priority, and that for this disease, SCID in this case, they would be committed to working with the national patient group and with the international patient group to make sure that patients had good access to treatment and good early diagnosis. So this is really something where we were very excited. We had a good event. We had a very good Twitter presence. We told people about it. We invited lots of doctors and patients to come along. We had people from respiratory societies, from the National Rare Disease Organization. So a really wide body of people all aligned on the same ideas about improving this key ask. We then got sort of a very important step, which was the follow-up. The meeting finished and we continued to talk with the members of parliament. What are you doing? Where can we try and integrate these ideas in your current work? And a social inequality bill came up, and several of these members of parliament tabled resolutions to try and include the newborn screening in their general program of diseases that would be covered by newborn screening. So we had a really tangible result, which all started from us saying, we have an idea at European level, what can we try and do at national level? And really the work there is of course a lot of hours which go into doing these things, but you can start very small by just saying, let's talk to someone and see where this goes. Because really when the members of parliament get involved and get active on this type of topic, things really take off. So that was just my little case study. I think that we're nearing the end, so I'll just pass back to Jelena now to sort of sign us out of our main part and then head into questions and answers.
Yes, so to conclude our fifth step, whatever option you choose for yourself, whatever looks more feasible for you now, or maybe in the future when your capacity hopefully grows, there are several points which is worth to consider organizing any kind of meetings, especially with the policymakers or any other stakeholders outside of the community. Short meetings are the best. The shorter the better, because then the message is very clear. The uptake is very good usually in that case. It's very important not to forget about the audience needs. it's always important to think what the other person would get from meeting with me. What can I give to them? Despite the fact that we have been talking today about asks of the community, it's always useful to keep in mind that other parties do have their own needs too. This leads to the second tip, to the third tip, sorry, that the meeting should be a dialogue, that you should always listen to the party you are meeting with. And of course, it's an excellent material to use everything you have been working very hard as volunteers or professional patient advocates. Take your materials with you, present all of them to the policymakers. One of them is, of course, Alpha-1 expert recommendations, which are also translated. One of the tips here is because unfortunately, politicians, even if they have interest in the topic, it's very likely that they will not have time to read the entire book of the recommendation. So it's always very useful to have one-page document, one-page summary on top, saying that this is what we want. This is our main ask. We know that you can do it because this and this legislation is coming up. Please do it for us. So yes, those were our main things which we would like to share with you. There are many more, but we're short in time, and we would love to leave a little bit more time for the discussion and for your questions. So now we will have Q&A session. So whatever questions or concerns or any comments you would like to address with us, please do it now. In order to do this, you need to raise your hand. You will, on the top of your screen, you will have an option, raise your hand. So once you raise it, we see it, and then you will be unmuted, so you will be able to speak with us. Alternatively, you can write it in the chat, because maybe you don't have a microphone. Okay, for the moment, while you're thinking about the questions, I would like to give a word to Frank. I'm sure most of you know him. He's an active Alpha-1 global community member, and he's also a representative of Alpha-1 Plus Belgium. And I would like to ask Frank to share of his experience of volunteering and working at the same time, because Frank is one of the most passionate health advocates I have met in my professional career, and he has a lot to share with you.
Thank you, Jelena. Can you hear me?
Yeah.
Yes, fantastic. I just would like to take 2 minutes to share something about my work I did here in Belgium, because the first time I met some MEPs was in 2014, and I had the possibility to meet 2 members of the European Parliament, Belgian ones, Mark Tarabella and Mark de Backer, a socialist and a liberal, to talk about Alpha-1, because as you know, in Belgium we have a special situation, kind of discrimination. Some patients are treated, other patients are not treated. And I was so amazed not to get to the European Parliament, but to feel this kind of direct democracy, that it is possible. Well, it takes a couple of weeks to get there, but it is possible to get in and to have 20 minutes to speak about our problems, about things I would like to change and to go further. And these 2 people really, they wrote, both of them, a letter to our health minister, to our Minister of Public Health. And I was very amazed how things are running. And it is fascinating that this kind of visit and of action can have such such an amazing suit in the next steps. And the second time, of course, it was in 2017, was last year, when we prepared the launch of the booklet in the European Parliament, where I met the 3 members of the European Parliament, Sepp Dans and Malinina and Sirpa Pietikäinen from Finland. which was a great event. And now in December, I did a micro mailing on the national level to 9 members of the Belgian Parliament with our booklet in the English version to ask for some meetings to discuss about Alpha-1. And it was quite before Christmas, and I got 2 out of 9 today to meet them in the next weeks. And I think that's very important also in all these landscape of awareness where we have different tools and so many stakeholders. Well, not to bring all them together, but it's the same landscape. And more we do on different levels, of course, more we have a kind of synergy. So in our case, in Alpha-1 Plus in Belgium, for me, it's a main point always to stay with the lung doctors. There are 450 lung doctors in Belgium, less the liver doctors. It's a question of time. But also to distribute the booklet in in COPD associations or in events where the lung diseases are very important. So I just want to stop there to say it makes sense a lot to do these kind of steps. And as we saw, most of us, we had contacts to politicians and to stakeholders. And so I will say, keep going with this kind of action. And in the next weeks, the booklet will come out in several languages. And I think it's a wonderful tool to do the next steps in 2018. Thank you.
Thank you very much, Frank. That was very interesting and hopefully useful for other volunteers and sites. I can see some chat messages saying, asking for the copy of the webinar and the presentation. So this will be distributed. This webinar was recorded. So if you lost something somewhere in between, there is no problem. You will receive the recorded version as well as the checklist and the presentation. Yes, so the link will be sent via email. I can see the message from Gunhild. Thank you very much for your kind words. That was a pleasure doing this webinar. But we still have time, and I would like to ask once again if you have any questions. If not, maybe there is someone who would like to share their political ask, because we had the practical task to do so, to draft one if you haven't had one before. So maybe that would be an opportunity to check what kind of political ask national members have. Okay, I do not see any political ask on my feed, but this is not a problem. I understand that today you probably had an overload of information from us, and you can check your strategy, your political asks, or any kind of questions you might have through Frank or through us.
This is Honi Guterres again. Thank you both for the presentation. And probably the participants are still thinking and having their minds go 100 miles an hour. So we know where to find you. We can always follow up later. So thanks again, everybody. I know it's late in Europe, so good night and good health, and we will be in touch.
Bye and have a good evening.